ladies and gentlemen. Today is dewormer day for my little kittens, so I thought I would show you guys what exactly I do on dewormer day. Now, if you have a copy of my book, Tiny But Mighty, you'll find that there's a whole section about deworming and different GI parasites that kittens can have. This is my GI parasite cheat sheet, and it explains the name of each common parasite, what it is, how they get it, symptoms, and treatment. The important thing to know is that you don't want to just wait until you find out that they have parasites to treat them. We can assume that most of the kittens that we get in are very likely to have the parasites I'm talking about here, so we're going to treat them prophylactically, which means preventatively. You'll find that in the book I share some of the common medications that are used for treating kittens. It's of course important for me to say that you're going to be medicating kittens under supervision of a veterinarian, so talk to your vet about the medications that work best for your kittens and you. The medications that I use for deworming are pyrantel, pamoate, and this is going to treat against common parasites like roundworms and hookworms. Then I'm going to be using fenbendazole. This is used to fight and prevent giardia. Panazaril is a prescription medication that you're going to need to get from your vet, and this one is going to be used to treat coccidia. I'm not making a specific recommendation. You should talk to your vet about what works best for you. This is just what I use. Now, most rescue organizations start deworming at 2 weeks of age and repeat after 2 weeks. And that is what I do as well. Of course, if the kitten is younger than 2 weeks and they have an extreme parasite load that is potentially fatal to them, I will treat them younger than 2 weeks. But the important thing to know is that everything you do, you are dosing by their weight. So before I can deworm my kittens, I'm going to weigh them and find out exactly the right dosing that they need. Again, get your dosing information and your medication through a veterinarian. So I'm gonna tear my scale. Okay. Shining Sunbeam is first. How much do you weigh? 606 grams. Good job. So I'm gonna just write that down. Shining Sunbeam, 606 grams. Then I'm going to turn that into pounds, and I have my handy cheat sheet here, so that is about 1.32 pounds. Good job. Purple Crown Fairy is 615 grams, and that is just about 1.35. Good job. Good job. All right, next up I have Fire Crown. Fire Crown weighs in at 615 grams. That's the same as your sister, so that's 1.35 pounds. Good job. Lil Woody. So, Lil Woody, oh, you're small. She's $5.99. So that is gonna bring us to just about 1.3 pounds. And Mountain Gem weighs, wow, you're huge, dude. 730 grams. Okay, so 730 grams is gonna bring us to just about 1.6 pounds. Okay, wow, you're so huge. Now the reason that I put them in this is actually just a refrigerator drawer, and I really like these because they're just tall enough that the kitten will stand on the scale without jumping out of it. You did a good job. You did a good job. Mwah. You did a good job. Okay, so now I have their weights in grams and I have their weights in pounds. And this is going to give me the information I need to safely dose my deworming medications. Okay, so now I have my 1 cc syringes and I am going to use these to pull up my medications. In terms of dosing information, you should definitely talk to your veterinarian about that. Okay, so I've got my pyrantel ready. I've always thought this stuff actually smells pretty good. It smells like cake batter or something. I don't know that the kittens agree with me, but we'll see how they like it. Okay, so when you're ready to give your kitten their medication, you just gently hold their head in place, and then you slip this into the side of their mouth like that. Ew, yucky! That's not the favorite. It's not our favorite, but it helps us stay healthy. Okay, did you guys get that? Let's do another one. I'm gonna hold his head steady. I'm gonna gently put this in the side of his mouth. And there we go. Good job, Mountain Gem. No worms for you. Let's do one more just to make sure you guys got it. I'm holding her head steady. I find this little gap in her teeth right there, and that's that. There's your medication. Good job, Fire Crown. Okay, so now we're done with our Pyrantel, and that drug is just once every 2 weeks. Now with these two, you're usually going to use them a couple days in a row. I want you to talk to your veterinarian about what they recommend, but what my veterinarian recommends is 3 days on the fenbendazole, which is also called Panacur. So 3 days on Panacur and then 3 days on Panazerol. If the kitten has really serious Giardia, then we'll do a little bit longer on the Panacur. But again, talk to a vet because the vet knows best. Now we're gonna pull up our Panazerol. That one's kind of icky. Ugh, yucky, icky, yucky. Yuck. Ugh, yucky. But that's gonna help you not have coccidia. And coccidia is nasty, you don't want that. And we got our last round of our coccidia medication, Panazerol. Ooh, it's so icky. I know, it's gross. It's disgusting. Sometimes when they get their medication, you'll see that they lash their tongues around or they shake their head. That's okay. They'll get over it quickly. You can give them a little treat. Now we have our Panacur, also known as fenbendazole. If you feel bad for these kittens getting their medications, just open the book and see what the alternative is. If they get these parasites and they keep these parasite loads in their tummies, they are risking diarrhea, constipation, lack of appetite, nausea, vomiting worms, blood in stool, labored breathing, watery or mucousy diarrhea, abdominal distress, dehydration, foul-smelling stool, weight loss, gassiness, bloating, and even fatality. So take this really seriously. You do want to deworm your kitten. You don't want to wait and find out that they're extremely symptomatic. Just go ahead and deworm your kittens on a regular schedule. Okay, I'm sorry in advance. I know this one's icky. I know this one's icky. Oh, icky. It's gross. I know. It's okay. We got this. It's gonna be over soon. It's gonna be over soon. Oh, it's gross. It's gross. It's yucky. Oh, we don't like it. We don't like that. You got this. It's just one more and you're done. Oh, it's so gross. It's so gross. You guys are it. After this, we're all done. After this, we're all done. Good job, good job, good job. Wow, you did a great job. You took that like a champ. How are you gonna do? Let's see if you can do a good job too. Oh, it's so yucky. It's so yucky, but you guys did great. And now you're all done. And you're not gonna have no more little yucky, uninvited visitors in your bellies. And that's a good thing. Good job. You guys did it. You got your dewormers. You guys will forgive me later.